Hello, good evening. Am I audible to you people? Can you hear me? Good evening, Rajaram. Am I audible to you? Thank you, Rajaram, Namburu, Surya. Good evening. Good evening, Sananda. Happy Valentine's Day, Sananda. Thank you very much. Dr. Yash, good evening. Yes, we should not forget happy things in life. Happy Valentine's Day. So, you all are supposed to be happy today. Why should we be happy? Because finding love by itself is a happiness. And for those people who say they don't have love, it's okay. You can actually get love at any point of time. Not everybody can have love on Lover's Day. Likewise, not everybody is supposed to be having something at some point of time or at all points of time. Sometimes we may not have something. But what we consider as love can be different. So when you actually love to be a surgeon, that is love. When you want to become a dermatologist, that is love. So you are working towards what you want. That is what we should settle for. 19 subjects, MCQs, target NEET PG, high intense quiz. This is what we are going to do. Okay. So good evening, Salman Bhatki, Sunil Kumar, Divya Vinayak, Sheikh Nizili, Salman Bhatki. Yes, Dr. Yash, Abhishek Narai. Very. Yes, thank you very much. So let's begin the session. Before we go to the questions, again, there is one more session on 16th Feb, that is day after tomorrow, same time, 7 p.m. And whatever questions we are leaving at this point of time, we'll be doing it the next class. We'll be doing it as a very short session, but we will try to do the best. And this is to explain you who I am. I'm Dr. Meenakshi Sundaram A S, MBBS, MD, gold medalist in MD exams. I'm a high octane educator for biochemistry and microbiology for the past 11 years. The good thing is I have actually placed many students into the top education institutions including AIMS, PJ, Chandigarh, JUPMER, NIMANS, etc. consistently for the past 11 years without a single break. So I hope if at all I reach out to you and you get a seat there, it'll add to my happiness. So please be a source of my happiness. I like to be a source of your support. Okay, and there is something called as All India mock test coming up. Please mark the dates, Feb 26th, 9 a.m. And this is All India mock test where the patterns and questions are predicted for the main exams. And you can boost your NEET PG preparation with 3 months buying and 1 month extra. And you can use code DRASM Live. This is DRASM or DRASM Live. You can use any of these codes and you can get a 10% discount and exclusive access to all my classes. You'll be having daily live classes, live tests and quizzes, structured courses, unlimited access to all the sessions. And this is iconic subscription. And these are the upcoming tests that you can go for. You have a test on 15th Feb, that is FM Pharmacology and Microbiology, 45 questions. Special class features, there is interactive live classes, polls for the season, raise a hand, never miss a class by recorded session, lecture classes, and anytime, anywhere. Lecture notes will be available. There's also raise a hand feature, and there's updated question bank series. These are the NEET PG toppers. You can raise your hand and you can ask questions directly to the teacher. And NEET PG 2022 All Educator Revision batch is present, and Focus FMG 2022 Comprehensive batch is also happening. And there is a Focus FMG 2022 December batch and Target Next 2023 batch where I'll be teaching for the Target Next 2023 batch students, and the classes will be beginning on 21st. And there is an ultra fast revision batch course. This is where I teach also, so you can come up for my classes. So this is the NEET PG subscription till 16th of February, and these are the prices. I hope you'll be able to use them. So let's go for the quiz contest, and let me tell you, please use code. Please make a note here. Go to menti.com. I'll write it here again, menti.com, and use code 63226726 to play the game. For those people who are very new to this particular type of quiz contest, for those who are already knowing this, it's fine. For those people who are joining the quiz contest for the first time, let me tell you, go to the website menti.com parallelly using any other device or using the same device. But if you use a parallel device, it'll be helpful for you to listen to what I'm saying and the explanations, and you can also have your marks considered. So go to menti.com. In that page, you'll have a small box. In that box, introduce this particular code 63226726. So if you're ready, please give a thumbs up. I can go for the first question. Tell me if you're all ready. We'll go for the first question straight away. Thank you, Abhishek Narayan, Surya M. Please go to menti.com and use code 63226726. 63226726. It can be helpful. Thank you, Rajaram, Venkatesh Kumar. Yes. So let me begin the session here with the first question. We'll go for full screen mode. And if you're not able to see the words clearly, please use high definition mode or high data mode. It can help you see the letters better. Okay, so let's go for the first question. Answer fast to get more points. Maximum contribution to the floor of orbit is by which bone? Thank you very much, Salman Bhatki. Is it maxillary? Is it zygomatic? Is it sphenoid? Is it palatine? Which one? The maximum contribution to the floor of the orbit is by which bone? Maxillary, zygomatic, sphenoid, palatine. Can you parallelly tell me how many bones will be contributing to the floor of the orbit totally? You're very close, Rashti. The majority wins. The answer is maxillary. Can anybody tell me what is the total number of bones present in the floor of the orbit? Anybody? No, not 3. It is a very small number you're thinking. There are so many small bones. Can you tell me what it is? Okay, just consider this. Please go back and revise the number of bones. You'll be surprised to see that. Okay, Paulomidas, that is correct. So let's see the leaderboard here. Let's see how many of you have gotten it right. Very good, Namburu Kiran. Okay, this is the leaderboard. Surya, Sana, Sri, Sayantan, Tamilanda, Dr. Mish, Namburu Kiran, Bill, Dickens and Horika, and Shami. Very good. Dickens, Horika. Do you know who is Dickens, Horika? Horika Dickens is the other name for what? Can anybody tell me? See, you have a person who is in the top 10 and the 9th holding person is Dickens Horika. Can anybody tell me who is Dickens Horika? Dickens Horika comes across field of medicine where? See, Horika Dickens is the other name for hexose monophosphate shunt, also referred to as pentose phosphate pathway. It is also referred to as direct oxidative pathway. Welcome Dickens Horika and others. So Surya has given the fastest answer, Sana is second. Now let's go for question number 2 of 28. Answer fast to get more points. That is how we have set this paper. Okay. Nephron is derived from. Look at the embryological point of view. Nephron is derived from what? Is it ureteric bud? Is it mesonephric duct? Is it metanephros? Is it mesonephros? Which one is the right answer? Okay, anybody else? Okay, Alex, Rashti and Paulomi are saying C. Sakshi Singh is saying B. Sheikh Reena Nazir is saying C. Anybody else? Come on, people. Okay, everybody has voted. The right answer is metanephros. Remember, the nephrons is actually a collection of these functional units of the functional unit of your kidney. When it comes to kidney, there are two important portions. One is the one that is acting as the excretory, secretory and collective part. The other one is the collective portion of the urine. That is the urine forming portion and the urine collecting portion that can send into the ureteric duct. So in those areas, the nephron is coming through 3 different phases: pronephros, mesonephros and metanephros, where the ureteric bud can actually be considered about the beginning stage where the collection can happen, but metanephros is the ultimate part where the nephron is actually derived from. And also remember, when it comes to kidney will go for a rotation and actually climb up from the pelvis into the abdomen in the retroperitoneal area, while when you focus on the scrotum will move from the abdomen into the, that is outside the abdomen into the scrotum. The testis will be moving from the abdominal area or the pelvic area into the scrotal area that is present outside the abdomen. Both of them will be rotating. That rotational failure can also cause the embryological abnormalities. Now let's look at the leaderboard here. Okay, Rajaram and Ribbit have gotten the right answer this time. So they are into the top 10. Sayanthan, Dr. Valentine, Sri, Dawkins, Salman, Surya, Sana, Rajaram, Ribbit, Tamilanda have got into the top 10. Yes. And then let's go to the next question here. Question 3 of 28. Okay. Thank you, Srashti. Answer fast to get more points. Which of the following is not a branch of first part of maxillary artery? The previous question was a combination of anatomy plus urology. This one is just a combination of facial anatomy. And which of the following is not a branch of first part of maxillary artery? It is middle meningeal artery, accessory meningeal artery, inferior alveolar artery, and greater palatine artery. Which one? Excellent, Rashti Katiyar, but try to give your answer in the menti.com website so that your answers will be counted. The answer would be greater palatine artery, middle meningeal artery, accessory meningeal artery, inferior alveolar artery. Both can come as a part of first part of maxillary artery. So totally maxillary artery can be divided into 3 major parts, and out of that the third part is the one which is the palatine part, will be the one which is carrying the greater palatine artery. So greater palatine artery comes as the part of the third portion of your maxillary artery. Can anybody tell me how the maxillary artery is divided into 3 portions? What divides them into 3 portions? The maxillary artery is divided into 3 parts. Who divides the maxillary artery into 3 parts? Anybody? Okay. Lateral pterygoid. Excellent. The lateral pterygoid. The lateral pterygoid muscle, one of the muscles of your mastication, will be helpful for dividing the maxillary artery into 3 portions. The greater palatine artery will come into the third portion. Okay. Now let's look at the leaderboard here. So Sayanthan has come on top. Sayanthan, Sri, Salman, Tamilanda, Namburu Kiran, Dr. Valentines, Dika Hurricane, Abhishek, Shamis, Dr. Centipede. These are the people. Yes, it lies. Okay, so this is the top 10. Now let's look at the next subject. This is question number 4 of 28 coming up from physiology. Let's see who answers faster. Answer fast to get more points. In spermatogenesis, independent assortment of the paternal maternal chromosomes occurs during what? Primary to secondary spermatozoid formation, spermatogonia to primary spermatocyte, secondary spermatocyte to spermatids, spermatids to spermatozoa. Which one? Remember, you are trying to convert 2n into 1n or 1n into 2n. Tell me, you're trying to convert 2n into 1n or 1n into 2n. Diploid or diploid to haploid or haploid to diploid. What is the logic here? Okay, most of you are saying C, but the answer is not C. The answer is A. You're trying to go for primary to secondary spermatocyte. So tell me, you are going from 2n to n or n to 2n. What is your understanding here? Look at the question once again. In spermatogenesis, independent assortment of paternal and maternal chromosomes. When you're going for separately paternal and the maternal chromosomes, you tell me, am I going for n to 2n or 2n to n? Yes, it is 2n to n. You're going from diploid to haploid. At that point of time, you'll be able to generate primary to secondary spermatocyte. So remember this information. This is physiology, embryology, and anatomy coming together. So let's look at the leaderboard here. Sri, Tamilanda, Shami, Centipede, and Sana have given the right answers. Anybody else? Okay, Sri is fastest and Sri is on top. Tamilanda second, Sayanthan third, Shami fourth, Salman fifth, Centipede sixth, Namburu Kiran seventh, Dr. Valentine's eighth, Sana ninth, and Dickens and Horeca 10th. Now let's go to the next question here. Question 5 of 28 are coming up on your screen now. Answer fast to get more points. All the following are true about excitation contraction coupling, except which one is false? Acetylcholine is released at the nerve terminal. Calcium is pumped back into the sarcoplasmic reticulum during relaxation. Calcium is released from the sarcoplasmic reticulum during contraction. Calcium binds to tropomyosin to initiate muscle contraction. Which one is the false statement here? Yes, come on people, try your best. Excellent, Sayantan Basu. Very wonderful answer. The majority has actually won again. Remember, acetylcholine is released at the nerve terminal. Now, that acetylcholine can actually cause excitation. That excitation can actually be coupled with either secretion in case of glands or contraction in case of muscles. So, calcium, when it is going for, actually when there is a contraction, the calcium should be filling the sarcolemma. It should not be present inside the sarcoplasmic reticulum. Once the relaxation happens, the calcium has been sequestered back into the SR. So whatever you call as ER in terms of normal cells, the equivalent will be called as SR in case of the muscle cells. So calcium is pumped back into sarcoplasmic reticulum when there is a relaxation. That's a true statement. Also, when the sarcoplasmic reticulum is actually offering you the calcium into the sarcolemma, then that is actually causing contraction. But calcium binds to troponin C, not to the tropomyosin. When calcium binds to troponin C, actin filaments are getting activated. This is what is our logic. So let's see who is on the top right now at the end of the session. The end of this question. Question 5 of 28, done. Okay, so Sri is on top, Tamilanda second, Sayantan third, Centipede fourth, Dickens fifth, Valentine sixth, Shami seventh, Salman eighth, Namburu Kiran ninth, and Rajaram 10th. Well played, people. Now let's go to the next question. I repeat, there is one more session that is on 16th. This will be the end of the particular quiz contest that are happening. I hope you will be able to come. So I'm just planning it. Will you be okay? Will you be coming for the quiz contest? If you're saying we'll try to do something more special, it's possible, if it's possible. Question 6 of 28. Let's answer fast to get more points. Transcutaneous electrical nerve stimulation is based on what principle? Is it the principle based on central pain? Is it based on referral pain? Is it gate control theory of pain? Or it is helping us understand allodynia? Which one? Okay, for those people who are saying C, 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 and C, please put your answers on the particular slide here. See, go to menti.com and use the code 63226726. You will be able to play the game. We have just started the quiz contest. We still have 25 more questions to go. At the end of it, you will be able to see whether you're in the top 10 or not. So if there are some 70 to 80 people participating all over India, you should be able to see where you can stand. For that reason, try to take the quiz. Your answers here. If you're wrong, everybody will be able to see that you're wrong. But if you're right, nobody will be able to give you credit for it. But if you could actually put the answers here, then we'll be able to see where you stand in the top 10. Even if you're not in the top 10, you will know where exactly you stand. For that reason, it's just my suggestion to go to the top of the screen, www.menti.com, and use the code 63226726. So let's go for the next question here. Before that, let's look at the leaderboard. So the top 10 people, all of them have gotten the right answer here. So it won't make much of a difference in the top 10. Sri, Tamilanda, Sayantan, Centipede, Dr. Valentine's, Dickens and Horeca, Salman, Shami, Rajaram, Sana are on the top 10. Okay. Vinod Sigamani, the link is, there's nothing called as link. Please go to the website called as menti.com. This is a very simple website with a single page. In that page, there will be nothing except a small box. Then the whole page will be empty except for a small box. When you click on menti.com and use the code 63226726, you'll be able to play the game. Okay. Thank you very much. Now let's go for the question number 6 of 28. Sorry, 7 of 28. Answer fast to get more points. Which of the following is known as suicidal enzyme? This question may look very simple, but just try to think before you answer. Is it lipoxygenase, cyclooxygenase, thromboxane synthase, or 5-nucleotidase? Which one is it? Which one is called as suicidal enzyme? Sheikh says D. Anybody else? Okay, the time is up. And I think majority has given the right answer. Yes, 11 of them, 11% has given the right answer. It is cyclooxygenase. Now, most of you would have answered it based on the concept that aspirin causes social inhibition. Yes or no? Most of you gave the answer based on aspirin causing suicidal inhibition. Yes or no? See, there is a difference in the way that you have answered the question. I have framed the question in such a way, even if you did not think about the topic or the logic or the concept, you would still get the right answer. Remember, there is something called as suicidal enzyme. There is also something called as suicidal inhibition. When aspirin inhibits cyclooxygenase, it's an example of suicidal inhibition. Here, this is suicidal enzyme. What is enzyme? What is the meaning of a suicidal enzyme? The enzyme which can destroy itself so that the particle pathway is not moving forward. Suicidal enzyme is the enzyme which can destroy itself in such a way the pathway will not be able to move forward. At the same time, suicidal inhibition means when you introduce an inhibitor, that inhibitor will be acting upon by the inhibitor will be acted upon by the substrate in such a way the substrate gets altered. Because the substrate is getting altered, it won't be acted upon by the corresponding enzyme, because of which it is released into the urine. I repeat once again, if for example you're using allopurinol in case of gout, allopurinol will be acting as it will be acted upon by the xanthine oxidase enzyme, and that becomes alloxanthine. Now that alloxanthine will not be acted upon by the xanthine oxidase anymore, so uric acid will not be formed. I repeat, when there is a suicidal inhibition, the drug will be acting upon the particular enzyme, or the enzyme can act on the drug, because of which the drug is altered and the enzyme is also altered, because of which enzymatic action will not be able to move forward. The reaction gets stopped midway. Okay. Srashti Katyar, it is not very easy to look at both of them together. You need a separate device. If at all you use your laptop for viewing the video, you can actually use the phone for going on the menti.com. If it's not possible, it's very difficult, it's okay, just be on the menti.com itself. Now let's look at the leaderboard here. So Sri has slipped. It means the top position may be displaced now. Okay, Tamiranda is first, Sayanthan second, Sri third, Dr. Centipede fourth, Dickens fifth, Rajaram sixth, Valentine seventh, Salman eighth, Surya ninth, and Hypergarified 10th. Well played. Now let's look at question number 8 of 28. We're moving forward. Answer fast to get more points. Exact location of a genetic locus is identified by a pathology question. Exact location of a genetic locus is identified by, this can be a molecular method also, fluorescent in situ hybridization, polymerase chain reaction, chromosome painting, comparative genomic hybridization. Which one? Okay, so 5 more seconds. Come on, give up your answer. Yes, everybody has voted. The right answer is fluorescent in situ hybridization. It can exactly fluoresce the area where the genetic locus is needed. Now, what is the function of polymerase chain reaction? Polymerase chain reaction, ligase chain reaction, transcription, mediated amplification. All these three techniques are together called as nucleic acid amplification test, NAAT. These have high sensitivity of more than 95%, where they will be trying to amplify a given strand of RNA or DNA. Chromosome painting is capable of painting left and right, and it is capable of finding out the aberrated chromosomes. So chromosomal aberrations can be found out by chromosomal painting. What about the comparative genomic hybridization? This is capable of differentiating between a normal kind of genome and a cancer genome. So the one which can exactly identify the genetic locus would be fluorescent in situ hybridization. Now let's go for the next question. Let's look at the leaderboard here. Yes, very good, Paulami Das and Dashu. Yes, this is the leaderboard here. So Tamiranda is on top, Sri is in second, and Dr. Centipede third, Sayanthan fourth, Dickens fifth, Rajaram sixth, so Dr. Valentine seventh, so eighth, Doc is ninth, Abhishek 10th. Some people have entered into the top 10 and some have been pushed outside. Come on people, don't give up. You will be able to make it. For those people who have joined just now, please go to the top. Read the top of the screen. Menti.com. Go there and use the code 63226726. You will be able to get into the game right away. Okay, now let's go for the question number 9 of 28. Answer fast to get more points. Okay, very good, Srashti. True about ribozymes. When you go for molecular techniques, what does ribozyme do? Is it having peptide transferase activity? Does it cut DNA at specific site? Does it participate in DNA synthesis? It has GTPase activity. Which one? Which is the right answer here? Okay, Abhishek says yeah. Alex Armugam says C. Anybody else? 5 more seconds. Anybody else? Okay, that's a wonderful guess. The right answer would be peptidyl transferase. The majority has given the right answer. Remember, all enzymes in the world are made up of proteins, except ribozymes, which are made up of nucleic acids. So here, the peptidyl transferase is a nucleic acid and not a protein. It is capable of helping in translation. Cutting DNA at specific sites will be the function of restriction endonucleases, and participation of DNA synthesis can be a property of any other enzyme, including DNA polymerase activity. So let's look at the leaderboard at the end of this question. Okay, I think Tamilanda will now be displaced. Okay, Dr. Centipede is on top, Sri is second, Sayanthan third, Tamilanda fourth, Dickinson Horeker fifth, Rajaram sixth, Valentine seventh, Surya eighth, Doc ninth, and Abhishek 10th. Nobody has gained entry into the top 10 from again. Now let's look at the question number 10 of 28. Answer fast to get more points, people. Which of the following does not indicate megaloblastic anemia? Increased reticulocyte count, raised bilirubin, mild splenomegaly, nucleated RBCs. Among the following, which one is not a property of megaloblastic anemia? Which one is not seen in case of megaloblastic anemia? Come on, people, you can do it. Yes, come on. Yes. For those who have joined just now, look at the top of the screen here that you're seeing on the screen. Menti.com is the website that you can actually go to and click on the particular box and fill the box with the code that is shown on the screen 63226726, and you will be able to enter into the game as instantly as possible. Now many of you are giving answer as B. That the answer is not B. The answer would be increased reticulocyte count. So why did you say B? Because you think megaloblastic anemia. In megaloblastic anemia, remember, the RBCs are not proper and they are blast cells. So tell me, blast cells are more stable or less stable in the circulation? Quick question. When you have a megaloblastic anemia, the blast cells are more stable or less stable in the circulation? I'm having a simple question. When you have megaloblastic anemia, the blast cells will have lesser stability or more stability, less stability. So because of which easy hemolysis can happen. So because of that hemolysis, you can expect unconjugated hyperbilirubinemia. So raised bilirubin is a property. At the same time, because of excess amount of RBC destruction, the splenomegaly can happen, which is moderate splenomegaly. And also remember, because it's a blast cell, the nucleus has not been removed, so nuclear RBCs can be seen. But in case of megaloblastic anemia, you'll be having a hypercellular marrow. I repeat, you'll have a hypercellular marrow. It is not releasing the kind of blast cells faster or the reticulocytes faster, so there is a decreased reticulocyte count in the circulation. I repeat, there will be a hypercellular marrow and you will be having all the reticulocytes being held on to the marrow. It will not be released so faster, so it is decreased reticulocyte count in the megaloblastic anemia. I hope you will be able to use it. Yes. Yes, very good. Now this is the leaderboard. The moment you start treating vitamin B12 deficiency with vitamin B12 or folic acid deficiency with folic acid, the reticulocyte counts can slowly increase. Dr. Centipede is on top, Sayanthan second, Tamilanda third, Dickens Horeker fourth, Sri fifth, Surya sixth, Rajaram seventh, Valentine's eighth, Sweet ninth, and Doc 10th. Okay, Sweet has come into the top 10. Okay, very good. Let's see who is actually holding on to the fort at the end of it. Now we are going for question 11 of 28. Answer first to get more points. Platelet addition to collagen occurs via factor 8, factor 9, von Willebrand factor, fibronectin. Which one is the right answer? Dashu says C. Anybody else? Okay, so most of you have given the answer C. The majority has given the answer C. Remember, whenever the platelets are flowing through the central column of solutions, just a minute. So the central flowing column of blood, only when there is an injury, the opening of the endothelium can be seen. When the endothelium opens up, the internal collagen can be exhibited. Now, if the platelet has to bind to the collagen, you require a connecting factor called as von Willebrand factor, and that is important for coagulation cascade to begin. Okay, to start or to be in portion. Now, this is the leaderboard at the end of this question. Very good, Srashti. Weevil pulmonary bodies can have von Willebrand factor and is a carrier of factor 8. So remember, it's a very close call. No, most of you, it is not a very tough question, but it can be a close question. Some of you can think of why factor 8 could have been the answer, but no, it is von Willebrand factor. Dr. Centipede is on top, Sayanthan second. Sayanthan and Centipede are very close to each other. Tamilanda is also next close. Sri Dickinson, Horace Surya, Rajaram, Dr. Sheldon, Dr. Valentine, sweet. Dr. Sheldon has come into the top 10. Excellent, Sheldon. Let's see who can actually come into the top 10 again in the next question. Let's go for question 12 of 28. Answer fast to get more points for this question also. Markers of acute kidney injury include all the following except: is it microRNA 122? Is it cystatin C? Is it NGAL? Is it KIM1? Which one? That's a wonderful contribution from Srashti. Thank you very much, Srashti. That is when von Willebrand factor deficiency is a very common cause of bleeding diathesis. Then when a patient comes, that is especially a pregnant female comes with menorrhagia, or when a patient comes with menorrhagia or a pregnant female has a lot of bleeding diathesis, first rule out von Willebrand disease. Thank you very much for introducing us to the information, Srashti. Okay, so in this question, we are looking at marker which is not a marker of acute kidney injury. So everybody has voted. Again, the majority has won. The right answer would be microRNA 122. So can anybody tell me why this is the right answer? Can anybody tell me why this is the right answer? Yes. Sorry. Okay, no problem. See, remember, when you are focusing on functional markers, the answer would be serum creatinine. But when you go for physical structural markers of kidney injury, you go for cystatin C and NGAL. While microRNA 122 is a marker of acute liver injury. Please make a note of this. MicroRNA 122 is a marker of liver injury. That is why this is the right answer at this point of time. I hope you'll be able to use this information. Is that okay? NGAL, cystatin C are all markers of acute kidney injury. Even when you go for markers, one thing can actually speak about structural destruction of the kidney coming out in the urine. Sometimes functional failure of kidney can be reflected. NGAL, cystatin C will have both structural and functional release simultaneously. It is specific for liver. Okay, let's go for the leaderboard here. Okay, Dr. Centipede is still holding tight. Okay, Tamilanda has displaced. Dr. Centipede, Tamilanda, Sayanthan, Dickinson, Horeca, Surya, Sri, Rajaram, Hypergarified, Doc, Tejasri. Wow, Tejasri has come into the top 10. This is what I've been speaking about. You can always make it to the top 10 at some point of time. It is always possible. Please go to the website that is shown on the screen right now. Whatever you're seeing on the screen on the top, you can go to the website www.menti.com and use the code 63226726. Okay, now let's look at the next question, question 13 of 28. MicroRNA 122 is a marker of liver injury. 70-year asbestos factory worker. He has been working for 15 years. A right lung apical region mass, biopsy of mass done. Electron microscopy will reveal what? Numerous long cylinder microvilli, melanosomes, desmosomes, neurosecretory granules of the cytoplasm. Which of them? Raju, the microRNA 122, if at all you have your hands on a hepatocyte by biopsy, you will be able to see it even early. My question was about among the following in case of acute acute kidney injury, which one is an exception. That is why it is microRNA 122. It can hold still for a very long time. MicroRNA 122 speaks about the injury to a liver or the presence of liver abnormalities for a very long time until that hepatocyte is in picture. Excellent, very good. The right answer here is malignant mesothelioma. I repeat once again, this is a case of malignant mesothelioma. Now, there is a single thing that you would like to know. Remember, whenever somebody is exposed to asbestos, there are different kinds of asbestos particles like ricodolite, anthracite, amorphosite, etc. Now you'll be having different shapes of the asbestos fibers. Those asbestos fibers will be directly capable of entering into that part of the lung which is having a straight bronchus. Which lung has a straight bronchus? Anybody? Which lung has a straight bronchus? Which lung has a straight bronchus? Yes, so that particular lung is more commonly known to have tumors because of asbestos. Now, when asbestos is present, it is capable of causing mesothelioma and is also capable of causing adenocarcinoma of the lung. But when mesothelioma is taken into consideration epidemiologically, if a person is exposed to asbestos and also he is a smoker, it will not be an additive effect. That is, the effect of smoking, the effect of asbestos will not be additive, it will become multiplicative. For example, if a person is normally not working in an asbestos factory and not a smoker, the chance of him having asbestosis or mesothelioma is lesser. But if at all he is working in asbestos, the increased risk is by 10 times. The same person is also smoking, the risk can increase by 100 times, which is 10 into 10. So it is multiplicative effect of acquiring mesothelioma or adenocarcinoma. So this is an occupational hazard that can cause diseases. Now, the microscopic picture will be long slender microvilli. Let's see who has gotten it right. Okay, Tamilanda, Dr. Centipede, Sayanthan, Surya, Sri, Dickinson, Hara, Rajaram, Doc, Abhishek, Tejasri. Abhishek has come back into the top 10. Well played. Come on, people. Question 14 of 28. Answer fast to get more points. Which of the following induces apoptosis in a cell? Among the following, who is capable of introducing death of a cell on its own? Oleic acid, glucocorticoids, isoprenoids, myristic acid. Which one? Pathology hardcore question. Anybody? Very good, Srashti. The most common cancer would be lung adenocarcinoma. The most specific cancer would be mesothelioma in terms of asbestosis as an occupational hazard. No. Please think twice before you answer this question. We are asking you a question. Among the following, who is capable of inducing apoptosis in a cell? Okay, so the answer would be glucocorticoids. Can anybody tell me how glucocorticoids work? Okay, quick question. How does tacrolimus work? How does tacrolimus work? Cyclosporin, tacrolimus are inhibitors of what? Cyclosporin and tacrolimus are inhibitors of what? Now I'm trying to help you understand this particular question's explanation. Which of the following induces apoptosis? The answer is glucocorticoids. I'm asking you, what is the role of the cyclosporin and tacrolimus? They are inhibitors of calcineurin. When calcineurin inhibition happens, ultimately NF-kappa B will be altered. So that is the same pathway taken up by glucocorticoids also. I repeat, Glucocorticoids are capable of affecting NF-kappa B and bring down the NF-kappa B transcription and translation. At the same time, there is something called as I-kappa B, inhibitor of kappa B, which can be superimposed by glucocorticoids. Glucocorticoids can increase the production of I-kappa B. That I-kappa B can suppress the NF-kappa B, because of which the normal biochemical or normal molecular division of a cell does not happen. So because of which apoptosis can be induced. There are three mechanisms for glucocorticoids to induce apoptosis. So please take a note. All the three pathways will go through one single logic, that is NF-kappa B alteration can be done by glucocorticoids. They induce apoptosis. Okay, now yes, look at the leaderboard here. Tamilanda, Dr. Centipede, Sayanthan, Surya, Rajaram, Sri, Dickinson, Horika, Doc, Abhishek, Sotu. Sotu, wow, amazing. You have come back into the top 10. Wow, you have come to the top 10. Excellent, congratulations. Now, let's look at the question number 15 of 28. Answer fast to get more points. Duration of action of Lumozinyl. What is the duration of action of Lumozinyl? Among the given options, 10 minutes, 20 minutes, 30 minutes, 40 minutes. Which one is it? Can anybody tell me what is the function of Lumozinyl? The one direct function of Lumozinyl is what? A very striking function of Lumozinyl is what? Excellent. It's a benzodiazepine antagonist. The majority has given the answer as 20, the next majority has given 10, and the next majority has given 30, but the right answer is 40 minutes. Remember, Lumozinyl can be given IV, and when it is given IV, the work will be for 1 to 2 hours. So none of them are exactly true, but in the previous question it was asked, in the previous exam question of AIMS, when it was asked, it was given 40 minutes. Among the following 4 options, you should have been choosing 40 minutes, which is closest to 1 hour, the minimum amount of 1 hour. So the duration of action of Lumozinyl is definitely 1 hour to 2 hours. So please take a note of this. It can be definitely for more than 40 minutes. Okay, now let's look at the leaderboard here. Nobody in the top 10 has given the right answer, so there is no change in the leaderboard in the top 10 position. Now let's look at question number 16 of 28. Answer fast to get more points. Drugs having both alpha and beta agonistic properties, which one? Is it phenyldopam, dopamine, epinephrine, phenylephrine? Which one? Drugs having both alpha and beta agonistic property is which one? Phenyldopam, dopamine, epinephrine, phenylephrine. Dashu and Abhishek Mohanty, think again. We are looking at alpha and beta agonistic property. Can your answer fit for both alpha and beta, or either for alpha or beta? Okay, Srishti Katyar has given the right answer. Raju also, think about it. Dopamine will have its own dopamine receptors. So dopamine receptors agonistic activity can be noticed. You can have D1, D2, D3 receptors. They don't actually think about alpha, beta agonistic activity. Remember, the difference between epinephrine and norepinephrine is that epinephrine can act on alpha 1, alpha 2, beta 1, beta 2, and beta 3. But norepinephrine can act on alpha 1, alpha 2. It can act on beta 1, but no beta 2 action, and it has beta 3 minimal action. So the difference between epinephrine and norepinephrine is epinephrine has beta 2 action, which can cause vasodilatation, while norepinephrine cannot have beta 2 action, because of which there is no vasodilatation. So when both of them have been injected, epinephrine may actually increase your heart rate and increase your cardiac output, but it won't cause a drastic rise in BP compared to that of norepinephrine, because when norepinephrine has beta 1 action, it increases the force of contraction, rate of contraction, but there is no corresponding dilatation of blood vessels. Because the blood vessel volume is the same, the pressure keeps on increasing manifold. Also remember, epinephrine can have both alpha and beta activity. Dopamine mostly acts on D receptors. Now let's look at the leaderboard. Tamilanda, Dr. Centipede, Sayanthan, Surya, Sri, Rajaram, Dickens, Abhishek, Tejasri, Dr. Valentines. Again, Tejasri has come back into the top 10. Yes. Now let's go for question 17 of 28. Answer fast to get more points. Which of the following drugs can be stopped abruptly without much withdrawal symptoms? Think again. Is it escitalopram, fluoxetine, fluoxamine, sertraline? Which one? Okay, 10 more seconds. Anybody else? Which of the following drugs can be stopped abruptly without much withdrawal symptoms? Escitalopram, fluoxetine, fluoxamine, sertraline. Let's see. The majority has given the right answer. Excellent. The fluoxetine is the best answer. Why? Fluoxetine is an example of an SSRI, selective serotonin reuptake inhibitor, but the drug has a slow onset of action and also has a very prolonged action even after stopping it. Now, what is the point here? When fluoxetine definitely has lesser withdrawal symptoms than any of the drugs put together. Why? Even after stopping fluoxetine, the dosage of the drug in the blood will be at least minimally present. So that itself, this concept will itself act as a tapering mechanism for fluoxetine, because of which withdrawal symptoms will not be abrupt. I repeat once again, even if you withdraw it abruptly, even if you stop it abruptly, the withdrawal symptoms will not happen so fast. Why? Because the drug will not be completely eliminated from the circulation faster. So that itself can act as a tapering kind of effect of fluoxetine, SSRI for antidepressant. So, yes, Dr. Centipede is on top, Tamilan second, Sayanthan third, Surya, Rajaram, Sri, Abhishek, Tejasri, Dickens, Horeca, Ribbit. Wow, Ribbit has come into the top 10. Excellent, Ribbit. And if possible, you people are here online, please, Dr. Centipede, Tamilanda, and Dickens, Horeca, Ribbit, please tell us your name. Please tell us your name. It can be helpful. It will be helpful for other people to get inspired from you. Dr. Centipede, Tamilanda, Dickens, and Ribbit. Okay. Yes. This is what we have discussed last in the previous quiz contest, Rashti. Thank you very much for remembering it. Question 18 of 28. Let's go for the faster questions and faster answers to get more points. Compared to unfractionated heparin, low molecular weight heparin has reliable anticoagulant action because of what? It interferes with thrombin and antithrombin 3 simultaneously. It is less protein bound. It is given subcutaneously. It is cleared by macrophages. Which one? Oh, thank you very much, Shrutika. That's a very good guess. You are doing a very good job. Amazing. You are coming to the top 10. Congratulations. Other people can get inspired from you. And Dr. Centipede and Tamilanda, if you're here, instead of being on the thing, please tell us. Oh, nice, Dr. Yash. Yash, are you Tamilanda? Are you Tamil? I thought you're a Kannadiga. Okay, because I remember from KGF, Yash will be a Kannadiga is what we felt. But nice. Okay, so the right answer here is it is less protein bound. Wonderful. Yes, that is the right answer. Majority has given the right answer. Unfractionated heparin, low molecular weight heparin. These two are more commonly used in that there are special conditions where LMWH can be used. One such example is when the patient is having a stroke-like episode because of slow coagulation or thrombosis in your brain. And remember, the only reason where LMWH can be more reliable is because it is less protein bound. So the availability to the right area, the target area, is higher compared to that of unfractionated heparin. Availability is more. Instant availability is more. Oh, nice, very much. Longer T half. Okay. So now Tamilanda. Okay, Sayanthan is on top. Tamilanda second. Dr. Centipede third. Surya fourth. Rajaram fifth. Sri sixth. Tejasri seventh. Abhishek 8th, Ribbit 9th, and Dr. Valentine's 10th. Excellent, well played. So top 10 position. Come on, people. Let's look at the next question here. Those people in the top 10, don't give up your situation, and those people who are outside the top 10, try to break into the top 10. This is how the competition can be fun. Okay, question 19 of 28. Let's go for the next question here. Doctor or a nursing person disclosing the identity of rape victim is punishable under the following section of IPC. Which one is it? Is it section 228A, 222A, 224A, 226A? Which one? Yes, unfractionated is safe in case of renal failure. Very good. I said in special conditions you will require LMWH. Please think twice before you answer this. Disclosing the identity of a rape victim is punishable under the following section of IPC. Which one is it? 228A, 222A, 224A, and option D. Which one? We have 5 more seconds. Anybody else? Yes, come on people. Excellent. So here there is an equal fight between that of A and C. The answer is A. Remember previously the rape. Okay, can you tell me what is the section for rape? What is the section in case of rape? 3. Come on people. 370. Yes, it is 376 IPC. In that you can have subsections A, B, C and D. In all these 4 subsections, if at all the identity of a person has been published in a paper or anywhere else in documented form, it is highly punishable up to 2 years of imprisonment and fine. Fine and imprisonment for 2 years. The point here is it was not in vogue till 1983. In 1983, this kind of section was introduced for protecting the identity of the rape victims. I remember fine plus that of 2 years of imprisonment started from 1983. Now let's go for the leaderboard here. Excellent. Definition is 375. The rules have been as 35, 375. Okay, very good. So look at this part. Sayantan is on top, Tamilanda next, Centipede, Surya, Rajaram, Sri, Dr. Valentine's, Abhishek, Tejasri, Ribbit. Excellent. You all are holding on to the top 10 areas. Now let's look at the next question here. Question 20 of 28. We still have only 9 more questions. The thing is becoming hotter. Let's see who will be the winner at the end. Lateral traction test is done in unnatural sexual offences in which person? Is it done on the habitual active agent? Is it done on the pedophilia active agent? Is it done on bestiality active agent or habitual passive agent? Think about the unnatural sexual offence, habitual active agent, pedophilia active agent, bestiality active agent, habitual passive agent. In these 4 people, where will you be performing lateral traction test? It's a previous year question. Okay, Paulamidas, Rashti Katya, Lingeshwar are giving us the right answers. Yes. So, yes, the majority has given the right answer. The answer is habitual passive agent. In this, whenever there's an anal intercourse happening, if a person has been a habitual passive agent, when you use your hands on the butt cheeks of both the person and you go for a lateral separation of the butt cheeks, and then if you extend your finger into this area, you will be able to see the sphincter allowing the entry of anything easily if he is a habitual agent. If at all he is not a habitual agent, the sphincter tone will increase massively whenever you're trying to introduce something into the anal canal. So lateral traction test is done on the butt area, especially in case of anal intercourse, unnatural sexual intercourse offense, where when the passive agent has been habitual for a very long time, when you go for traction separation of butt cheeks and introduce something into your finger into the sphincter area, if he is habitual, the sphincter will easily allow it to enter inside, but if he is not habitual, it won't allow the entry. Okay, now let's look at the leaderboard here. Okay, Surya, Sri, Tejasri and Ribbit alone has gotten the right answer. Excellent. So Sayantan, Tamilanda, Dr. Centipede, Surya, Sri, Rajaram, Tejasri, Valentine's, Abhishek and Ribbit are on the top 10. Excellent. So let's look at the next question. Question 21 or 28. Answer fast to get more points. Recommended daily intake of iodine in pregnancy is what? This is a PSM question. Also a biochemistry question. Is it 90 microgram? Is it 120 micrograms per day? Is it 150 micrograms per day? Or if it is 250 micrograms per day? Do you even understand? It is 1/4 of a gram. That is what we are looking at. RDA at the level of 1/4 of a gram for a pregnant female. Only during pregnancy and lactation, you'll be having most of the RDAs being higher, so focus on it. Okay, the answer, some of you have gotten it right. The answer is 250 micrograms. The majority wins. Remember, in simple words, whenever it comes to iodine in terms of pregnancy, it is just 1/4 of a gram that is needed for a pregnant female. And this is important for proper brain development and also for maintaining your thyroxine levels and thyroid gland normalcy. Okay, let's look at the leaderboard here. Okay, so I think Tamil Nadu will be displacing again. Tamil Nadu is on top, Sayanthan second, Dr. Centipede third, Surya fourth, Sri fifth, Rajaram sixth, Valentine seventh, Abhishek eighth, Ribbit ninth, Tejri 10th. Okay, Tejri has come back into the top 10 once again. Welcome. Okay, now let's go for question number 22 of 28. Answer fast to get more points. Epidemics after disaster are caused by all the following except which kind of infection? Is it leptospirosis, rickettsiosis, leishmaniasis, acute respiratory infection? A combination of microbiology plus PSM, try to go for it. Which one is not expected in general after epidemic? After disaster. For example, if there is an earthquake, volcanic eruption, tsunami, in these kind of mass climatic changes or cataclysmic events, what kind of epidemics can be expected? Which one is not expected? Is it leptospirosis? Is it rickettsiosis? Is it leishmaniasis? Is it acute respiratory infection? No, Maheshra, I'm not from Telangana. I'm from AP. And my relatives are in Telangana, but I have settled in Tamil Nadu. Epidemics after disaster are caused by all the following except leishmaniasis. Most of you have gotten it right. Excellent. Remember, whenever there is a disaster, if the disaster is a type of water-based disaster like flooding, when the water is flooding into the local area, and if an infected rat is urinating into the flooded area, the rat urine can spread leptospira, and that rat urine, when mixes with the water in the local area, the water on splashing on all the faces, the water will contain leptospira. Leptospira is invasive. At the same time, all the kinds of rickettsial vectors will become active when there is an abnormal cataclysmic event going on. So when the rickettsial vectors are able to come out into the open, they bite you and they can spread rickettsiosis. But remember, the most common diseases that can happen after disaster would be diarrheal infections followed by acute respiratory infection. So you cannot choose D. Leishmaniasis is not very common after a disaster. So let's look at the, yes. Oh, thank you, Dr. Yash. Yes, Vachu, Dr. Raju. Telugu Vachu. So Tamilanda is still on top, Surya second, Sayanthan third, Dr. Centipede fourth, Sri fifth, Rajaram sixth, Abhishek seventh, Dr. Valentine's eighth, Tejri ninth, and Ribbit 10th. Yes, nice. So this is a place where a lot of conglomeration of languages can happen. Here, how many of you are Tamil, how many of you are Telugu, and how many of you are Bengali? I think Sayanthan is a Bengali. Am I right? Sayanthan? Dr. Valentine's, can you tell us your name? Manohar Hossain, are you also from Bengal? Dr. Yash is Tamil? Yes, Dr. Yash. So you are the Tamilanda? Tamilnala Varma Yashikku. Okay. Anybody else? Yes, Sayanthan is Bengali. Paulamidas is Bengali. Duri Ravishankar is Indian, but I know you are from Bhubaneswar, right? Duri Ravishankar, you are an Oriya person. Tejashri is from Telugu. Okay. Okay, Salman Bhatki is Gujarati. See, this is the beauty of India. In India, it's unity in spite of having any kind of diversity. Diversity becomes the richness and unity is the strength. That is the beauty here. Oh, Dr. Yash is Coimbatore. Amazing. Lingesh is Tamil. Excellent. So we have people from different parts of the country. Thank you very much to Unacademy. I'm able to see all of you. And thank you to all of you for trusting me to come to the quiz contest. Are you all having a fun time? See, I know if I had taken an MCQ session, I would be teaching on and on and on. But if it's a quiz contest, you also will have some amount of role in it. That is why you will feel alive in a quiz contest. That is why I try to do this. Shall we do more such quiz contests? Srashti is from UP. Amazing. UP is the birthplace of Hindi, they say. I don't know, I'm not very sure, but I believe so. And when they say North Indian food like paneer butter masala, etc., UP is the place. Like especially when I go for Kanpur and Lucknow, they are the best places for having North Indian food. Oh, thank you very much, Dr. Yash. Yes, Manohar is from West Bengal. Okay, so if you all are interested, before we go for the NEET exam, we'll conduct one long session. That is a marathon session of revisions. It can be either MCQ or non-MCQ based revision in both biochemistry and microbiology before you go for NEET exam. Please let us know a wonderful time for you to happen. We'll do it between 7 to 8 or 7 to 9 so that it can be helpful for you before you go for the exam. Please tell us your date. Oh, Raju is from Telangana. Srashti is from Kanpur. Excellent. Okay, so let's go for the last few questions. Let's crack it open. Question 23 of 28. Last five questions for the night, and then we'll be meeting again on 16. That is day after tomorrow. Answer fast to get more points. Thank you very much, people. Oh, thank you, Srashti. Please help me get a butter naan and paneer butter masala. High toxic insecticide according to who classification are coded as what? Uh, I think there shall be a small mistake in this question. You please try to get the answer, but don't worry about the answer coming out. I made a mistake, I believe. After seeing this question, I think I made a mistake. Please forgive me in advance. Okay, so I think I haven't made the mistake. Excellent. Yes, there's no mistake, I believe. So the right answer is yellow. Look at this. The toxic insecticide is given the color yellow, but the container for the toxic insecticide will be red. Did you understand this? Okay. In this area, there might be a small confusion. To let you understand this, listen very carefully. The most toxic insecticide will have a particular code, and the container that contains the most toxic insecticide will have a different code. Is that okay? Extremely toxic is red. Okay, good. So don't worry about this leaderboard. Now, please forgive me for the small misunderstanding here. Question 24 of 28. Measles vaccination campaign between 9 to 14 years of age for elimination is keep up, follow up, mop up, catch up. A previous AIMS exam question. Come on, people. Very good. The majority has given the right answer. So what is catch up? This is a one-time activity done between the age of 9 to 14 years. When you have given the vaccination for children between 9 to 14 years by catching up with those children and then offering it to them, then whoever is missing, you will be going for the mop-up and follow-up. Generally, mop-up is not the word used. We go for follow-up. But if you want to keep up the same rate, then you go for keep up. So first you focus on catch up, then you keep up, and then you go for follow-up. And that is the campaign done for measles vaccination regimens. Excellent, people. Very good. Now let's look at the leaderboard here. Okay, Venki has come into the top 10 suddenly. Very good, Venki. Congratulations. So Tamilanda, Surya, Sayanthan, Centipede, Sri, Dr. Valentine's, Rajaram, Abhishek, Tejasri, Venki. Okay. Now let's go for question number 25 of 28. The last four questions. Answer fast to get more points. Topical steroids are not recommended post-surgery for which condition? Thank you very much, Raju. Please come for the day after tomorrow session also if you have time. So we are not going to use generally topical steroids for what? Allergic fungal sinusitis, chronic rhinosinusitis, antroquinal polyp, ethmoidal polyp. Among the following, topical steroids are not highly recommended for which of the following post-surgery? No, think twice before you answer. This is a very interesting question. See, the answer is antroquinal polyp. The most common reason for an antrochoanal polyp would be infection. In case of allergic fungal sinusitis, chronic rhinosinusitis, and ethmoidal polyps, the polyps can happen with or without infection, but antrochoanal polyp is not highly recurring, and in that area, the post-surgical topical steroids are not highly indicative. In case of allergic fungal sinusitis, allergy by itself can be a trigger for increased activity of the polypoidal cells. So please make a note of this. Antrochoanal polyps are not the ones who require topical steroids, and in case of allergic fungal sinusitis, topical steroids can help. Remember, topical steroids dosage should be added in such a way the steroid by itself cannot cause local immunosuppression, because of which fungal infection can become deadlier. I repeat, it is not for fungal infection per se, it is for allergic fungal sinusitis. When the fungi are the reason for allergic sinusitis, then you go for topical steroids. Chronic rhinosinusitis also, it is done. Okay, so let's look at the leaderboard at this end of the question. Surya, Centipede and Puffy have given the right answers for this question. Surya is on top, Tamilanda second, Dr. Centipede third, Sayanthan fourth, Sri fifth, Valentine sixth, Rajaram seventh, Abhishek eighth, Puffy ninth, and Tejashree 10th. Puffy has come into the top 10, Tejashree has come back into the top 10. Excellent, Srashti also. So question 26 or 28, the last three questions for the day. Come on, let's see who can make it to the top 10 at the end of it. Answer fast to get more points. What is placed during surgery internally for cochlear implant? When you perform a cochlear implant, what is placed during surgery? Microphone, speech processor, transmitting coil, receiver stimulator. Which one? Okay, so the majority has given the right answer. Well played, people. The answer is actually receiver stimulator. Why? What is the difference here? Remember one thing, when it comes to a microphone or a speech processor or a transmitting coil, all the three will be present outside, externally. But receiver stimulator is present internally. That is why I added the internal inside the bracket. When you perform a surgery, you're trying to put something internally. The internal as a word was not given in the question paper, but I just added it. What is placed during surgery for cochlear implant? The answer would be receiver stimulator, which is an internal component. All the other three are external components. So we are going for the last two questions. Let's see whether you will be able to answer the last four. Surya, Sri, Abhishek, Puffy and Venki have gotten it right. So Surya, Tamilanda, Centipede, Sayanthan, Sri, Abhishek, Valentine's, Puffy, Rajaram, Venki are the top 10 people. Let's look at question number 27 of 28. Answer fast to get more points. Bilateral proptosis in children is the most common presentation of neurofibromatosis, PNET, retinoblastoma, neuroblastoma. Which one? Okay, so we have 10 more seconds. Come on, people. I have a small request. If you all like the class, just help me put a thumbs up at the end of the session. When you are finishing the session instantly, please put a thumbs up. It can help the video reach many people. Thank you very much. The answer is neuroblastoma and not retinoblastoma. Remember this for the exams. See, the bilateral proptosis is our condition. And if at all you think about unilateral proptosis in adults and bilateral proptosis in adults, the answer would be thyrotoxicosis. And here the answer would be neuroblastoma. Please take a note of this information. Now let's go for the last question of the day. And if it's unilateral proptosis in case of children, it is orbital cellulitis. So Surya, Dr. Centipede and Anu have gotten the right answer. Anu has cracked into the top 10. Surya, Centipede, Tamilanda, Sayanthan, Sri, Abhishek, Dr. Valentine's, Anu, Puffy and Rajaram. Rajaram has also come into the top 10. Well played, people. So let's look at the last question for the day. See, try to be with us. And this is question 28 of 28. Answer fast to get more points. On your mark. Patient after road traffic accident presents with tension pneumothorax. What is the first line of management? Surgery. Insert wide bore needle into the second intercostal space. Immediate chest X-ray. CT scan for emergency thoracotomy. Emergency thoracotomy. Come on, which one is it? The third option, just take it as CT scan. I think emergency thoracotomy has come back into the option. Sorry about it. Okay, the last 5 seconds here. Yes, well played, all of you. Srashti, Naisargi, Meda, Kaustav, Raju, Lingeshwar, all are correct. Yes. So whenever there's a tension pneumothorax, if it's because of a road traffic accident, without any kind of question, insert wide bore needle into the second intercostal space. First, you remove the tension, you reduce the tension, because of which the patient's life can be saved. Okay, so we have done as many subjects as possible in this day's session, and in the upcoming days we'll try to do one more session here, and that is on 16th of Feb. We'll try to do one more session. In 15th of Feb we'll do one session. Sorry, 16th of Feb we'll do the next session. Please come to that one also. It is based on menti.com. Again, we'll be doing as many subjects as possible, and for all those people who have been present here, I love you unconditionally. I repeat, I love you unconditionally, and I wish that you get whatever you want. Those of you would be in love with certain kind of subjects. Some of you would be loving, it is generally second intercostal space. Some of you will be in love with radiology. Some of you will be in love with radiotherapy. Some of you will be loving general surgery, gastrointestinal surgery, nephrology, medicine, pathology, etc. And that love should be yours. And that is what I wish you on this Valentine's Day. All the very best to all of you. Happy Valentine's Day. And if you like this session, please put a thumbs up. Please put a thumbs up if you like the session. Thank you very much. Have a good night. Yes, this is the case was about a question of a child, right? The question was about a child or adult. I forgot the question. I'm so sorry. Okay, thank you very much. Have a good night, all of you. Okay. If it was child, it is second intercostal space. In case of adults, you go for fifth intercostal space if it's possible. Okay, what Srashti says is correct. Thank you very much. Have a good night. I love you, all of you. Have a good night. Please come back. Yes, thank you very much, Raju. Please come back on 16th, same time, 7 p.m. Please inform your classmates or friends from other colleges also. When more the number of people take the quiz, the more the fun it is. The more the fun, the more the learning, the intensity of learning will be higher. With that, I'll take your leave. I'll meet you again on 16th of February, 7 p.m. That is day after tomorrow, 7 p.m. for the final leg of this particular all subject MCQ quiz contest. Good night. Bye-bye. I'm sorry, I forgot to tell you the leaderboard. This is the leaderboard at the end of the whole session. Okay, so all of you have gotten right in the top 10. So Surya, Dr. Centipede, Tamilanda, Sayanthan, Sri, Abhishek, Valentines, Anu, Puffy, Venki. And Anu is on 8th position. Surya, Dr. Centipede, Tamilanda, 3rd, Sayanthan, Sri, Abhishek, Dr. Valentines, Anu, Puffy, and Venki. These are the top 10 people. Thank you very much for playing this game.